Hi friends, I'm here today to share my pain management strategy post-surgery. I had to have surgery back in March for some spine surgery, and I was petrified and I did not want to do it. However, that seemed to be the only option that would provide relief at the time. And so if you are in the situation of having to have surgery, I send you many blessings and I hope that it goes really well. And my whole intention here today is to assist you in not having to take pain medication or very minimal amounts of pain medication after surgery. I know it's very subjective and everybody's a little different. However, I chose to use essential oils instead of pain medication, and I found it very beneficial, so I hope you will too. So, jumping right in, the first thing I did a week before surgery, I applied 2 to 3 drops each of clary sage, frankincense, On Guard, and basil to the area of where I was going to have surgery to prep that area. And I did that twice a day. And I also applied On Guard and Melaleuca on my feet in the morning, in the evening to help boost my immune system. Additionally, because I was so anxious and unsure of actually doing it, if I didn't really want to do it, but I guess I needed to do it. And so I applied 1 to 2 drops of frankincense, balance, and vetiver, and I layered one on top of the other on the back of my neck and shoulders and inhaled that combination from my hands, and it really helped with relieving some anxious feelings, and it was super soothing on an emotional level. It just was really calming for me, and I really liked how it shifted my thinking pattern. So I used that 2 to 3 times a day as needed, before surgery and after surgery. It was just definitely one based on how I was feeling. And then daily, I was taking 4 to 6 drops of the deep blue polyphenol complex to help reduce pain and inflammation. And I would take them 2 at a time, 2 in the morning, 2 in the evening, 2 in the afternoon, and or I would take some before bed. I really just kind of let my body tell me what I needed, and I found that the deep blue polyphenol complex is really, really beneficial. I prefer to take them as a replacement for Tylenol personally. So then on the area, I had low back surgery, so I would use I would layer deep blue oil and then the deep blue stick and birch oil on my back, on my legs and buttocks area where all the pain was from the disc herniation and the other issues that were going on there with the nerves. So, and I would also apply basil and I would apply basil for muscle cramping and muscle twitching, because after surgery, like sitting and having to be in one place for so long, my legs and low back, shoulders, everything would just get really cramping. So basil works great for muscle cramping. And then around the incision, I would apply Immortelle twice a day, and keep in mind they had it bandaged, but around the bandage area for the first couple weeks, I would just do Immortelle twice a day. And then I would use Blue Lotus oil also, because that seemed to help relieve some muscle tension. And then right after surgery, after anesthesia, my throat and my throat was just really scratchy, and from the anesthesia procedures that they had to use. And so I used blue tansy and lavender on my throat, and I diluted it to help heal up that scratchiness from the anesthesia. And then I made a blend, and I still love this blend. It is equal parts of thyme, patchouli, lavender, and melaleuca. And my friend calls that, she made the blend, and it's called Thyme to Chewel. And it is wonderful for just like reducing pain because it's got that thyme in it, and patchouli is very grounding and calming. Lavender is super calming, and melaleuca is great for cleansing. I just think all things cleansing with melaleuca, but when you put them together, they smell fabulous. So I applied them to my feet in the morning, in the evening, to help reduce the pain and boost morality and recovery. And then I would layer that with cypress oil, because cypress oil is the oil of flow, and I wanted to keep the lymph moving in my body to help with recovery. And the also the blend, the Time to Chew blend, I don't know if I mentioned, but I added avocado oil as a carrier oil to that blend, and put it in a 10 milliliter roller bottle, excuse me. And then where they poked me, I had all kinds of pokes all over my body when I woke up, and I had some really bad bruising. So I used geranium essential oil on all the areas where there was bruising from the needle pokes. And geranium is really great for digesting old trapped blood, like underneath the surface of the skin. And then once the bandage was able to come off, I started putting geranium around the incision area, because it's really great for helping with nerve regeneration and regenerating tissue, skin tissue. And I alternated with lavender and did both. I would do geranium, then lavender, and then myrrh. Myrrh is excellent for scarring, so I used myrrh on there too. And then on the daily, I also would take Lifelong Vitality Pack, PB Assist, the microgreens, the doTERRA greens, and MetaPower Advantage, just as a daily nourishment for the insides and support all the systems of the body. And then I took On Guard soft gels, as I do anytime I start to feel a little bit ill, but I took them to keep my immune system boosted and to stop any to kind of get out ahead of any infection, make sure no infection set in, and which it didn't, so that was awesome. And then, so I don't know if any of you guys have been under anesthesia before, but it really affected my digestive system on a whole different level. And so I had to take, if you get a really sluggish digestive system for whatever the reason, this is what worked for me. I took Terrazyme, up to 6 a day, 2 at a time throughout the day, along with applying Digestin about every 10-15 minutes, or as often as I could think, to get the bowel movements moving and to keep the intestines flowing. And then I also made capsules of 4 drops of Digestin, 2 drops of ginger, 3 drops of peppermint, and 2 drops of helichrysum to get to get my intestines moving. And because of the anesthesia just stopped all that, and all that pain medicine, my body was not used to it. So it was like it went into shock, and all of that stopped. So I needed to get that going again. And that's what I used, and it worked really well. It took a little bit, but I got it to work. So I can't remember. I guess I had a negative reaction to stool softeners, and I put that in here. So if any of you have that and can't take them, I definitely recommend grabbing a pen, rewinding that, and writing those things down. And that, what did I do for that? Oh, I took Tri-Ease, which is lavender, lemon, and peppermint. And so that's what I used for the negative reaction. I think if I remember right, I turned really red and got really blotchy, like bumps on the skin, I think it was. But I can't say for certain. Anyway, I thought I'd tried remembering. And since, I also added magnesium supplements. Let's get back to focusing here. Anyway, so added magnesium supplements as well. And then I'm going to tell you, this is the ticket right here. So instead of doing pain meds, you can make your own. At least this is what I do as a super pain stopper, we'll call it. And I do 6 drops of frankincense in a veggie capsule, an empty veggie capsule, 6 drops frankincense, 5 drops of marjoram, 1 to 2 drops of clove and then 2 drops of digestion, and you put it in a veggie cap, and I took it as needed for strong pain and nerve irritation. After surgery, I found 2 to 3 times a day helped to keep my pain levels manageable, to where I wasn't in severe pain, but I was able to manage it. Like, I still had pain, but I don't know how to describe it. I wanted to feel it so that I didn't get up and do things, because I knew that if I felt no pain from medication, I would get up and go get stuff done. So this helps keep it manageable. And I have to say, I know another gal who had a foot injury on her foot, and she was taking pain meds and wanted something different, and I gave her we made capsules when she visited with that blend, and she couldn't believe the difference. Like, it actually helped her, and each time she'd come around, she's like, can I get one of those capsules? That stuff really works. So definitely recommend that. I wouldn't take it all the time, but if you need some relief on a temporary basis, that blend is amazing. So then I want to say that's about all. I know who likes to sleep. Everybody likes to sleep. So I also, to wrap this all up, I also took an adaptive capsule to fall asleep at night, which just helps to keep me calm and relaxed when trying to sleep. I do recall doing a veggie cap before bed of that of the super pain reliever blend, we can call it, the frankincense, marjoram, clove, digestion. I would take one of those. Then I would take some deep blue polyphenol complexes too, and it really helped to for me to be able to sleep through the night. So that was a lot of information. However, it worked for me, and I hope that you get something out of it. Or if there's somebody that you know that is having surgery or has some issues with pain, that this maybe will help them. Something in here, somebody will get some information that will be of assistance. And there's plenty of natural things you can do that can assist. So definitely do your research, or reach out and ask me. Put it in the comments and I can give you some more ideas. I would love to hear from you guys if you've ever used any of these, or if you've got some suggestions on what worked for you post-surgery. I would love to know what essential oils you used and how they helped you after surgery or for any type of pain relieving issue. Thank you so much for listening. I hope you have a beautiful day, and I'll see you next time.